The Baltimore City Health Department is planning to address concerns over drug use as it launches a new division of overdose prevention and harm reduction. Spotlight on Maryland's Patrick Hoff takes a look at whether these drug policies are effective.
Charles Lehman is a fellow at the Manhattan Institute focused on crime and drug research. He said studies on different harm reduction initiatives vary but generally show limited impact on drug overdose death rates.
They don't do very much to reduce the major harms associated with drug use. They don't do very much to increase the major harms associated with drug use, right? Like fears are often overblown.
We reported on how the Baltimore City Health Department recently launched a harm reduction vending machine in partnership with a taxpayer-funded nonprofit called Charm City Care Connection. Users can access needles, safer sex kits, fentanyl tests, naloxone, and more for free at the 24/7 machine in East Baltimore. A 2022 study by the University of Cincinnati on a harm reduction vending machine in Ohio showed that of the 124 people who re-enrolled in the program, 71% reported using naloxone from the machine to reverse a drug overdose. The study found a decrease in drug overdoses in the county with the vending machine, but stated it was unclear how much could be attributed to causation. A painting on the Baltimore City harm reduction vending machine says, "You don't have to get clean. You were never dirty." Lehman said harm reduction groups in some cities get distracted when they become too ideological.
I think it is socially and individually harmful to send people the message, it's not your drug use that's the problem, it's that people aren't accommodating your drug use enough. Like, no, we shouldn't accommodate drug use.
Mayor Brandon Scott asked the Maryland State House to pass a bill this year that would authorize Baltimore City to launch a harm reduction approach called overdose prevention sites, also known as supervised drug consumption sites, where people can legally use street drugs at facilities aimed to counter overdoses. The bill did not pass. Longitudinal studies on supervised drug consumption sites in Canada largely show little to no evidence that the facilities reduce overdose death rates, with one particular study published in the International Journal of Drug Policy concluding that Ontario's 9 consumption sites had, quote, no population level effect on opioid-related overdose emergency department visits, hospitalization, or death rates. A spokesman for Mayor Scott's office said city programs do not encourage drug use, telling Spotlight on Maryland, quote, harm reduction strategies allow the city to meet people where they are and connect them with the needed services. This approach prioritizes the health and well-being of residents.
Baltimore City won nearly $700 million in opioid settlement funds against pharmaceutical manufacturers and distributors. We'll continue to monitor how those funds are spent. For Spotlight on Maryland, I'm Patrick Huff.